To me, providing comfort means many things. The main meaning to me is to alleviate discomfort, both physically and emotionally, or to console. Everyone has things, people, or activities in their life that comfort them. One of a nurse's main roles is to provide comfort to patients. Patients receiving care are often vulnerable and in need of nurses' support, compassion, and understanding. Katharine Kolcaba's theory of comfort further highlights the idea of comfort as a key nursing role and explains why. According to Kolcaba, the function of nursing is the intentional assessment of comfort needs, design of comfort measures to address those needs, and reassessment of comfort levels after implementation compared to the previous baseline. Assessment and reassessment may be intuitive and/or subjective, such as when a nurse asks if the patient is comfortable, or objective, such as in observations of wound healing, changing lab values, or changes in behavior. Assessment can be achieved through the administration of visual analog scales or traditional questionnaires. I agree and think that assessment is intuitive and subjective, and that nurses must use their scientific and innate knowledge to assess a patient's level of comfort. An example of when I used comfort in my own practice was from my first clinical rotation at Surrey Memorial Hospital. The first patient I was assigned to had pneumonia and had been hospitalized for a few weeks. She had lost hope and wanted to give up. After relationally engaging with this patient, I was better able to understand her lived experiences. The patient grew tired of being in the hospital. Her family lived in different cities, and she felt that the healthcare staff did not care about her and that she was a burden to everyone. By using active listening and feeling compassion for this patient, I was able to console her. I knew the patient needed comfort in terms of a calming and supportive presence, so that is what I did. The patient expressed that she felt comforted by my presence and was appreciative of my level of caring. This patient's health improved, and fortunately she was discharged the following week. Before she left, she thanked me again for turning her hospital experience around and that it meant a lot to her. This example shows how caring and comfort can be simple, yet can make a big difference in a patient's life or lived experience. From my experiences, I have learned that the act of caring is crucial in providing effective and therapeutic nursing care for all patients. Comfort should include physical, psychospiritual, social, and environmental interventions. As I continue my nursing education, I think it is important for me to keep Kolcaba's theory of comfort in mind.